External Program Office briefing webinar for RFP applicants. We're expecting a few more folks to join us, so we'll go ahead and get started in just a minute or two. Thanks for your patience. Improvement Network Phase 6 External Program Office briefing webinar for RFP applicants. My name is Catherine Phillips. I'm a Senior Program Officer for the California Healthcare Foundation. I work in our Improving Access to Care portfolio, and for the past year or so, I've had the pleasure of serving as the California Improvement Network Project Director. Today, we're going to be covering the RFP opportunity for the External Program Office. We'll talk a little bit about the role of the program office, the specific activities, tasks, and capabilities we're hoping to see from our program office, the timeline for the work itself, and also the selection criteria and timeline for the RFP submission. A few housekeeping items. Everyone so far is on mute. We will unmute all lines when we go through our Q&A periods. We have 2 of those throughout the hour. We'll talk first about the capabilities and then take questions on submission timeline criteria, etc. Please be sure when we open the lines you do not place yourself on hold. You're welcome to type in questions at any time throughout the session, and you should see a Q&A box in the lower right-hand corner of your screen. We'll go through those and then again open the line for verbal questions as well. Also, we are recording the session today. A link of the recording will be available on our website in a day or so, and we will also be preparing a transcript of questions asked during the session and those that we receive in follow-up, and that will be available on the website by July 10th. All right. Well, I'm hoping most of you are familiar with the California Improvement Network, CIN for short, but I wanted to highlight a few pieces that I hope you'll keep in mind as you think about preparing a proposal. First, the CIN is the only network in California that brings together both commercial and safety net provider organizations, health plans, and the institutions that support them, quality improvement organizations, clinic consortia, and the like. We've consistently heard from CIN partners, members, and others that that is something that is deeply valued and something we expect to continue into the future. The CIN has been operational since 2005, so it has quite a history and legs underneath it. It's built a strong reputation as a trusted synthesizer and curator of QI content, and also as a resource for expert training on a wide range of care delivery topics. This year, for example, we covered topics ranging from excellence in transgender health to total cost of care, from different types of technologies provider organizations can use to improve patient outreach to alternative payment methodologies. So as you hear, lots and lots of different topics. While the CIN is primarily a technical assistance network, it is also a tool that we at the Foundation use to learn and to serve our members and our constituents better. It provides an important opportunity for us to be connected to provider organizations, health plans, and those institutions that support them, to have what we call an ear to the ground, to hear from them in their own words what their challenges are, what they're struggling with, what opportunities they see in the future, and what help, what resources, what assistance they need to take advantage of those. So 2 different components there, both things we hope to continue. There's much more information on the CIN on chcf.org. You'll see the specific website that'll take you right to the CIN portal there at the top of your screen. We encourage all applicants to look through this website. You can see examples of events that we've had in the past, of topics that we've covered, and the different types of technical assistance modalities the network has used historically: meetings, webinars, grants, and so forth. So please take a look at this if it's not something you're already familiar with. In March, the CHCF Board of Directors approved another 2-year funding cycle. We call that Phase 6, which is expected to begin mid to late 2017 and run through 2019. The total budget allocation for Phase 6 is $875,000. That represents a fairly significant increase from our most recent funding cycle. So an important signal that we are committed, recommitted to this network. Also in February, CHCF contracted with the Scott Group. Mary Kate Scott and Melissa Schoen, both of them are on the call today, to provide some strategic planning support. We wanted to learn more about the value of our first phases of work and identify some very specific improvement opportunities as we thought about reinvesting in future phases of the work. They conducted a number of interviews with CIN's partners and members, those that participated in Phase 5 and prior phases, CHCF staff, external experts, and also conducted some outside research on similar networks across the country to identify sort of the best in terms of strategy, in terms of programming, and most importantly in terms of structure and operations. They provided to us a number of recommendations on those areas, which we've taken and implemented into our thinking for Phase 6. Lots of different ideas came from that. We're only going to talk about a few of them today. You'll see many others reflected in the RFP document itself. The two big ones were both structural changes. The first being bringing in an external program office to provide strategic and operational support for the network moving forward. In prior phases, CHCF itself provided that to the network. Here, we're moving to an external organization that we would work with in close partnership on those activities. Second was bringing in an external evaluator to provide both real-time improvement opportunities throughout the course of Phase 6 and also to advise us as a foundation on potential future phases of the network. So two big changes there. Going into more detail now on the external program office opportunity. What are we hoping for? We're hoping for an organization that will lead the CIN, working very closely with CHCF and with CIN partners to co-create a strategy, program themes, conduct grant making, run communications, and provide or partner to provide technical assistance. That's the first. The second is to help ensure strategic alignment between CHCF programs and efforts and ensure that we are leveraging learnings from the CIN, getting back to that thinking about CIN as a tool for us to learn and to serve, and also to help support the evaluation, and we'll talk more about that. The timeline for Phase 6 is shown here on the slide. The RFP process is open. Applications are due on the 14th. We expect to make the external program office award at the end of July. August has been reserved for funded planning and onboarding time for the successful program office to work with us and partners to plan out the coming 2 years. We expect programming itself to begin in September, and you see some of the key tasks outlined there for the first quarter of activity. A little more now on program office tasks. I'll start by apologizing for the text here, but we wanted to have everything in print and in full detail. There were a number of folks who were not able to attend live today, and as I shared earlier, we have a recording of this. You will see this word for word in the RFP as well. So I will go through and call out either new items and items of particular importance as you begin thinking about if this is a good fit for your organization and how you might like to craft a response. We've bucketed the program office tasks into 3 categories and have tried to indicate who you would be working with on these activities. So I'll note that as well as we go through. The first bucket here, to create and leverage an annual forum for CIN partners and CHCF program staff. Moving forward, we hope to have partners more engaged in co-designing the goals, the objectives, and the programming for the network as a whole. Also, to create and lead a managing partner group. Historically, we've had about 15 partners. We're hoping to increase that to around 18 in this next cycle, but we'd like to have a smaller group, perhaps 3 to 4, that would take on even more ownership of planning and executing the agenda for the phase. Third is to create clear expectations of network partners. CIN is unique in that it has 2 different levels of engagement: partners and members. There's more about that in the RFP, and if there's questions, we can take those later in the hour. In our strategic planning process, one of the critiques we heard was that expectations and opportunities for both groups were not as clear as they could have been. And that's something we hope to improve, and we see a clear role for the program office in doing in this next phase. These 3 items are one we would, at CHCF, would expect to work with the program office hand in hand. They're also ones that would be prioritized for early work in that first quarter of the engagement. Bucket 2 here, recruiting new partners and designing and executing a robust technical assistance plan that meets the needs and interest areas of those partners. Again, this would be done in close collaboration with CHCF and also the managing partner group that I described a little bit earlier. Bucket 3, 6 through 10, these are ones where we would expect the program office to work fairly independently. These are the execution-related tasks: providing support forums, managing the CIN microsite, developing and disseminating CIN content and technical assistance, working through a thoughtful engagement strategy for members, and also supporting grant making. A couple notes here on the grant making requirement, because it's one we've gotten questions on before. CIN has historically provided direct technical assistance and also provided technical assistance in partnership with other organizations and has funded that work through grants. As we transition roles from CHCF to an external program office, we expect that grant making to continue. So an important part of this work will be taking on fiduciary responsibility for those grants, whether they be to support workshops, conferences, focused consulting engagements, or the like. If you'd like to see examples, again, please refer to the CIN website. 2 areas to look at there would be the events page and also the recent round of program consultation awards. Those will give you a flavor of organizations that have received grants from CIN and also more about how they used those resources to support the network. As I shared earlier, we also expect the program office to provide support for the evaluation. There will be an external evaluator, and that evaluator will have its own budget. So you, as the program office, do not need to budget to conduct the evaluation or to pay for the evaluation, but please, as you're thinking about staff time and resource, pay attention to that and make sure that you are allocating time to be supportive of the evaluation process. That could be data collection on utilization, for example, how many different types of organizations are attending webinars or workshops that you are hosting or you are arranging via partners and so forth. Also, we are hopeful that the evaluator will be able to provide both real-time within the phase improvement ideas and opportunities to the program office, and also to help them make an assessment at the end of the phase on future improvement opportunities. So be prepared to get feedback as you go through this process, both from Foundation staff and from the future evaluator. We have not yet released the RFP for the external evaluator. We expect to do that at some point early this fall, after we have named the successful program office and after we have a concrete timeline with them and a little bit more detail on the specific work plan, partners, and topics for at least the first year of work. All right. So now I would like to go through Q&A on capabilities and tasks. First, I'll walk through the questions we've received to date. Next, we'll take questions that have come in online, so please start typing if you would. And then third, we'll open up the phone lines and take live questions from those of you on the line. So 3 questions received to date that fall into this category. First, is there a preference for a current or former CIN partner or member? And the answer is that no. All eligible organizations are encouraged and welcome to apply. Please note, however, in our scoring criteria that prior experience and knowledge of partners and members and like organizations is important. So think about the experience, the history that you have with those. Second, why is the application and startup time so short? And the answer there is really our desire to limit the amount of time between the close of Phase 5, that was the end of March, early April, and the start of Phase 6, why we're hoping to begin in September. We didn't want too much of a gap time for our current partners and our current members without support. So that's the expediency there. We have provided August as a funded startup month for planning, contracting, onboarding, etc. We believe that's reasonable and fair. It's fast, but we hope it's doable. If your organization would need a few more days or a couple weeks to line up staff to really do kickoff in the way you'd want to do, we'll consider that. Please be sure to state that in your proposal and provide a rationale. If this is an opportunity that you'd like, but it would take many months to be ready to engage fully, then this probably isn't the right time for your organization for this specific opportunity. Third, what role will CHCF play in project office communications? There's a fair amount of detail included in the RFP, so please be sure to review that closely. The answer in short, however, is it depends. CHCF can provide communications-related support. That would include graphic design, editing, etc., pending need, if those activities are not something that the program office is comfortable doing. If they are, that's fine. CHCF will provide absolutely the website for which content webinar recordings, etc., will be posted. As we described in the RFP, we're going through a transition from our current site to WordPress. So the format will be a little bit different than what you see there, and the functionality will be improved. We also would like to keep consistency in our newsletter template and e-blast template, so we'll provide those. And like all of our grants, we reserve the right to review and approve publications and other communications products. So please be sure you're saving time in your budget, particularly for content development or communication staff, to go through that. Because there's some flexibility here, we would like to see you describe your organization's communications related capabilities and also your needs, what you would hope for in terms of CHCF being able to provide if for any reason you are not able to provide the full list of desired capabilities that you see listed in this area in the RFP. All right, so I will ask Lauren to open the phone lines, and I see a couple of questions that have come in. First one,
Catherine.
is there a version? Oh,
sorry, Catherine,
go
we
ahead.
couldn't hear you for a moment.
Oh, okay. I'm going through just the questions. Is there a version of the Scott Group Strategic Planning Report available for review? Great question. We do not have a public version of that report available now. I will say that the RFP itself reflects most of the changes that were suggested by CIN partners, members, and improvement opportunities observed by CHCF staff and the network experts that we contacted. So I think the RFP document itself contains the information you would need to know about what past partners and past members are hoping for in terms of future phase activities, offerings, and structure. Second question, I was curious as to whether winning this contract for the External Project Office would at all limit our ability to other projects or activities within the foundation. No. This is being advertised as an independent opportunity, so the successful applicant here would be eligible to apply for any other future opportunities that the foundation offers outside of the California Improvement Network. I will say that if you are the program office for California Improvement Network, we would expect you to budget all of your programming activities and staff time within your program office budget. Your organization would not be eligible for grant-making activities under CIN, because you'd already be the program office. But that would be the only CHCF opportunity that would be limited to you. Anything else within improving access or other portfolios remains open. The next question. Oh, I believe that was it. So let's move then to live questions. Lauren has opened the phone lines.
I can't open all of them because there's too much feedback. But there's still a handful of questions, Catherine. If you want me to read through them, I can, and you can just answer
That would be great. Thank you, Lauren.
Yep, no problem. So next question, would funding / reimbursing travel to CIN partner meetings be included in the grant-making task?
Good question. So the program office budget should be all-inclusive for all activities conducted by the program office itself, as well as any dollars that would flow to partners, members, consultants, or others that would support or engage in the network in some way. Historically, CHCS has reimbursed travel for partners and often others who attend meetings, workshops, training events, etc. That's been done.
We lost you, Catherine. We can't hear you anymore.
Lauren, is that better?
Yes, I can hear you now. Sorry.
Can you still hear me now?
Yes, I can.
Okay. Apologies for that, folks. All right. So I'm not sure where I lost you. I'll go through that last point very quickly. The program office budget should be all-inclusive. It should include all dollars that the program office itself will expend on this work, as well as any dollars that will be given, whether it's through a contract or a reimbursement for partners, members, or others who are supporting activity. Historically, the CIN had provided reimbursements for those partners, members, and others that traveled for workshops, training sessions, and partners meetings. For those that were traveling long distances. I would say when it comes to travel reimbursement, that's really something that's up to you. If you would like to continue providing that level of support to limit the barriers around participation, how much you devote to that and how you run that process-wise is really up to you. That's one reason we have requested, and we'll get to that in a little bit more detail in just a moment, that you provide a line item budget so we understand what you have budgeted for travel, consultants, etc.
Great. Next question. Can you please describe your current staffing model, role, and titles of each staff, and how you expect this to change or expand with expansion of CIN activities in Phase 6?
Yes, so I will speak with regards to Phase 5. The Foundation's had several iterations in different phases for staffing and for structure. In Phase 5, we had a program officer, a program manager, a program associate who provided event and logistics support. So we had 3 staff and then a cadre of communications staff as well. That included a web writer, an editor who helped prepare and proof newsletters, resource documents, etc. So I'd say there was a total of 5 roles. The FTE was up and down depending on need and availability, so I won't be able to share today what those numbers are. I would say we have proposed significant changes and some expansion in Phase 6. So please look at the activities that are detailed in the RFP and the capabilities that are requested in the RFP and use your judgment and make your plan about who you would need in terms of staffing and how much time those individual staff would require to achieve the goals and the activities listed there. Next question.
If CHCF provided communication support, would that reduce the budget available to the program office?
Not necessarily. As I mentioned earlier, we do have some flexibility in providing supplemental communications support. That's something we would negotiate in the contracting process, and as we develop work plans, what's needed, what we can provide, but you would not necessarily be docked or have the overall budget reduced if you tell us that you could do more and do better with that level of support. We would expect then that whatever dollars you would not spend, for example, on graphic design or proofing or other sorts of things, would be reinvested in some other area of programming for the network. Any other questions at this time?
Yeah, it looks good.
Okay, we'll move on and again have another opportunity for questions at the end of the session. All right, for proposal inclusions, please refer to the RFP for a detailed list of what we expect to see in your proposal. A few items to call out here. One, we're very interested in understanding the approach that you would use to engage partners and project staff and work collaboratively to develop and lead the managing partner group. Again, that's a new item for phase 6. To develop, maintain, and refine a strategic plan for the 2-year phase of work, and to provide program and technical assistance. That's where we would expect to see the bulk of the response in the detail there. We also want to understand how you'll engage partners and members and really drive network, what we've called connectivity, collaboration, and results. And you'll see more information on those areas in the RFP itself. The budget is important. We want to understand how you will allocate the resources that have been earmarked for the program office. That's $750,000 of the total amount. And by allocation, what we mean is how you will use those dollars for the different components of network programming. The program office and administrative functions, providing technical assistance to the network itself, workshops, training, and other ideas you may propose, and those flow through grant-making dollars for partnership activities. Of course, we want to hear about the skills and experience your organization have and the specific team that you are proposing have in managing similar tasks and the challenges that you see in managing the program office and the CIN. This is a large and diffuse network, and it's one that's undergoing a significant structural change and, we hope, significant growth. Those all come with challenges. We'd like to understand what you see and how you plan to address them. Selection criteria are listed here on slide 14. I won't go through them in detail, but I will say and call your attention that we have double-weighted items 1 and 2. Each one will be scored on a 1 through 4 score, but those that you see here, 1 and 2, project individual, team, and organization experience, and the approach, ideas, and creativity in your network enhancement are worth twice the others. That speaks to the weight you should give it in your proposal response and the level of detail that we expect in those sections. I'd also like to emphasize 2 points relevant to selection criteria. Number 1, as I started the call, the most unique component of the CIN is that it brings together safety net and commercial provider organizations, health plans, and QI hubs. So it's cross-continuum. We want and expect that to continue, so we'll be looking closely at your organization's experience, relationships, and plan around how to continue that. Next, questions received on proposal content. The first was, is there a specific form for the budget narrative? And the answer to that is no. There is a specific form you need to use for the line item budget. That's in Excel, and a link to it was provided in the RFP document. But the narrative can be a simple Word format. You can append that to your proposal or include it as a separate document. What we'd like to have is just a simple list of annotation for each of the categories that you have proposed. So as the example came up in the question earlier, in your travel category, how many trips are you planning, roughly for who, how have you thought about budgeting them? That level of detail would be very useful to us in understanding how you are thinking through your budget allocations, and also for us to know that the amount of money that you've put into the different categories is realistic given the activities and other things that you have proposed. Second was, should the line item budget reflect the entire project period or just year one? And the answer is the full 2-year period. So we want an all-inclusive project life budget. Third was a question on staffing. An organization that was interested said that they anticipate hiring a new staff member to fill a key position. And wanted to know if it was acceptable to include the job description in lieu of a bio-sketch or CV. Yes, if you have an open position that is a key staff member, please do include the job description. It would also be useful to have some detail on your plan and your timeline for filling that position. And last in this category, should we include a bio-sketch or CV for administrative staff? The answer there is yes, if the FTE for that person is going to be 10% or greater, or they are otherwise defined as key, that is critical, important to the work itself. If it's a little bit of time from someone on, event planning support, and it's not a significant contribution to the network and to your program office functions, you don't need to include it. But we would like to see and understand the experience, the credentials, and so forth of those that will be playing a meaningful role in supporting the network. So use your best judgment there. All right, any other questions on the proposal and or scoring criteria? Lauren, have any others come in?
Yes, there's a couple actually. Can you repeat the partner groups currently involved, QI, payers, etc.?
Sure, and I'll also direct you to the CIN website. There's a list there of the 15 organizations that were partners in Phase 5, as well as a little bit of information on each of them. Generally, the categories have been provider organizations, so organizations that provide health care and primarily ambulatory care, outpatient primary care services, health plans, and organizations that support providers and or plans. We've called those loosely quality improvement instructional hubs, but those are organizations that seek to advance quality or performance improvement plans or provider organizations. So those are the 3 categories to date. And again, names and mini bios for those that participated in Phase 5 are available on the website. We have tried to balance both type of organization, geographic location, commercial and safety net in the past, and again, we would expect that to continue into the future. Any other questions?
Yes. How many action groups are still actively engaged?
In Phase 5, which concluded end of March, early April, we had 3 action groups. Detail about that is available on the website. All of them were closed out at the end of Phase 5, and it will be up to the program office, the managing partner group, and CHCF as we go through that strategic planning process that was described earlier. If it makes sense to revive those groups come fall, or if we would like to select new topics on which to offer action groups.
And is there any flexibility in allocation of program office per portion of budget?
Yes. We laid out in the RFP some rough percentages for what we would expect the program office to spend on administration functions, on technical assistance functions, and on grant-making functions. But there is some flexibility. If your organization is going to propose something far out of those ranges, so a very, very different allocation, you're welcome to do that, but we would want to understand why and probably have a little bit more information on the rationale for that. There may be a very good reason for that, but we've laid out the parameters based on our past experience. So again, there is flexibility, but if you're going to go outside of the percentage ranges in the RFP, please be prepared to provide sort of justification and a greater degree of detail on why you're making that proposal.
And then can you share more information about your vision for the annual forum in the first quarter of the work plan?
Yes. And this comes from some of the improvement opportunities that were noted during the strategic planning process I described earlier. During phase 5, we used what I would call a just-in-time approach to strategic planning. That served some well, but not all well. And as we move into phase 6, we'd like to be a bit more structured in the way in which we go about selecting topics, selecting themes, selecting technical assistance modalities, and matching resource to need. There will certainly, given both the environmental space we're in and just the nature of this work, need to continue to be that ad hoc refinement and just-in-time planning, but we would like, again, to have a more organized process for setting an agenda for the phase. And that would be likely at the theme level for sure, and some in terms of topic as well. And some prioritization within those and parameters around that. So our vision would be that the Managing Partners Group, CHCF, and the program office itself would meet at the beginning of phase 6 and come up with a plan. What are the themes and topics that are of greatest need now, and plan those out in some detail, and also to come up with a process for how the Managing Partners Group and the Program Office will make decisions in the future as new needs arise. There were some ideas listed on the RFP, how to do that, focus group surveys, etc. That's not set in stone. Those were listed as ideas, but we would hope that strategic planning forum would sort of suss out a way in which to go about a plan so that all of us are sure that we are selecting the themes, topics, and needs that are of highest priority to the most folks. And that's important because, as we shared earlier, this is a very large and very diffuse network. We do want to prioritize the needs of partner organizations, but there are currently 4,500 members engaged in the network who also request topics, have ideas, and we want to have a clear, clean process moving forward for what gets put on the agenda. Any other questions?
One last question. Can you share a little more about the Foundation's hopes and dreams for CIN in terms of impact and results in the coming years?
Oh, hopes and dreams. First, we hope it continues and is able to simultaneously balance one of its past strengths which has been the ability to be immediately responsive as new topics and new needs arise from partners and members. So maintaining its nimbleness to be responsive to an ever-changing environment and to provide that sort of just-in-time best practice type of guidance, while also being a bit more structured, organized, and predictable, which we think is important to improve what we've referred to in the RFP document as connectivity, or also accessibility, letting folks know what they can expect, what the CIN will deliver, and having more connection points throughout the course of the phase. So my hope would be those two continue and balance. In terms of other hopes, as we've shared earlier, the CIN is regarded as unique in that it brings together so many different players from so many different parts of the healthcare continuum in a safe space in which everyone is free to discuss problems, challenges, and issues that they're having. And we hope that that type of safe space forum could continue and continues to attract and continues to engage that same diverse set of players. We expect to see some turnover, some change up, and in fact we want that in terms of the partnership group in the future, but we want it to continue to be a space for all, as I shared. I would say third, in terms of a dream, CIN, and I'll say this is one of the reasons, very candidly, we are shifting from the structure in which we had this year, that was foundation directed, to a program office staff. My dream would be that CIN could in the future be even more responsive than it has been in the past. Due to time, resource, bandwidth, and other issues, we haven't been in phase 5 as proactive or as responsive in terms of timeliness as I would hope. That's one of the reasons we've increased the funding amount in the future and come up with this idea of an external program office, is to have this be a top priority of an organization that has designated and devoted staff and significant financial resources to be able to address those needs fully and quickly. Any other questions? No. All right. Well, if you didn't get a chance to answer your ask your question today, or if you think of something new in the next week or so, we have a couple of different opportunities. You're welcome to submit questions via email. You're also welcome to request a time slot to speak with us individually and one-to-one, 30-minute interview types. We've listed some times here on slide 17 when Mary Kate Scott, Melissa Schoen, and I will be available to answer those questions. For purposes of transparency and fairness and making sure this is a level playing field, answers that we give to questions asked during those one-to-one calls will be published and will be made publicly available on the website, same place where you got the registration information for the session today. So please know that. Those will be published on July 10th, as well as any email questions that we get in the interim. But the one-to-one calls do provide an opportunity for you to talk through an idea, as well as ask any questions you weren't able to get to today. We've put the contact information for scheduling here on the screen, Lauren Van Dam. So please contact her directly if you'd like to sign up for one of those one-to-one phone calls. The recording of the webinar today will be available later this week on the website. And again, the transcript from questions today, as well as those received at future dates, will be available on that site on July 10th. With that, I thank you all for participating today. We look forward to seeing the proposal responses. And again, should you have any questions about the opportunity, please don't hesitate to contact us. Thank you again, and have a good day.